Hello, this is Melody McCune, and today I'm going to talk to you guys about health policy analysis and how it relates to school suspensions and student outcomes, and especially in specific relationship to two North Carolina general statutes that we will discuss during the presentation. Thank you so much, and I hope that you enjoy my presentation. The problem statement for this issue is, why do parents not get their children's school health assessments completed, and what are the effects of the children being suspended? There are many different variables that affect this issue. Number one variable is, does this current health assessment policy protect the vulnerable populations? These populations could include people living in poverty, people with transportation issues, parents or guardians that have mental health issues, and many more. The second variable is, does the current policy encourage suspension from school? And the third variable is, do available resources meet the needs? Are there enough medical providers in the community to perform these health assessments in a timely manner? And is there access for children who don't have insurance to get these health assessment forms completed? There are two general statutes I'm going to discuss today in North Carolina. The first one is Chapter 138-440.1. This one relates and states that every child in North Carolina entering public schools shall receive a health assessment within 12 months prior to the date of school entry. The second is General Statute 110-867, which requires that any child presenting to public schools in North Carolina must present an up-to-date certificate of immunizations. For both the immunization and the health assessment, the medical provider or parent or guardian must present a completed health assessment form or immunization certificate to the principal of the school on or before the child's first day of attendance. If the health assessment or vaccine record is not presented on or before the first day of school, the principal shall present a notice of delinquency to the parent or guardian. The parent or guardian will then have 30 days from the first day of attendance to present the required health assessment form and/or immunization form. At the end of that 30-day notice, the child will be expelled from school if the health assessment or vaccine record is not completed and turned into the school. On this slide, I'm going to talk a little bit about the background of this issue. Until school year 2016-2017, the need for a completed health assessment form only applied to students entering kindergarten. However, in that year, the regulation was expanded to include all students that are new to North Carolina public schools, regardless of the grade level. The health assessment is a very important form because it ensures that the school is aware of any medical or developmental concerns that can impact a child's well-being and their ability to learn and thrive in the school setting. School absenteeism is linked with poor student performance even in the early grades, which minimizing the number of days a student is absent from school is paramount. Missed days means missed learning, leading to lower test scores and reduced likelihood of graduating from high school. There is a lack of community awareness and understanding of the required health-related documentation that is needed for students to attend school. This can be the parents' misunderstanding or even the medical providers at times misunderstanding of this new statute. Effective management of students at risk for being kept out of school is challenged by the variations in school protocols for processing the health assessment forms. Data collection and management systems to keep record of students who were in danger of exclusions is not a standardized process between schools or school nurses. Some families face multiple barriers to come into compliance, like poverty, insurance status, mental health issues, inability to obtain a medical appointment in a timely manner, and language barriers. This graph on this slide shows the number of children that were not in compliance with required documentation within the 30-day start of school, and goes back to year 2013 to 2014 up to 2016-2017. And you can see it in Forsyth County alone, there were 244 children that did not meet the required documentation of either the health assessment form or the vaccination requirements. This is an alarming number because, as I stated before, if children miss school, that's missed learning opportunities and leads to poorer outcomes. There is a direct correlation between the cycle of poverty and lack of education. Children that are living in poverty often have a lack of opportunity due to the lack of education that they receive due to high absenteeism rates, due to multiple reasons. They're also likely to have lower incomes in the future and be dealing with issues at home like hunger, poor health, and poor living conditions. It's important that we look at health policies to address these issues so that we can help these children be successful. There are many important key stakeholders that are involved in addressing this issue of children being suspended from school and missing days and missing work. Some of those include parents or guardians and families, the children, the teachers, school administrators, school staff, school nurses, social workers, and local medical providers. There are many key factors that play into this issue. First one of those is the political factors, such as local legislators and the public being very interested in keeping kids in schools. There's reason to act now to keep these kids in schools because research shows that kids in schools are more successful and more likely to graduate high school. There are also social factors such as children living in poverty, non-English speaking, children that have transportation issues, or parents with mental health issues. There are economic impacts to children missing school too, because if children miss school, they're less likely to have higher incomes and has a higher economic impact because they're more likely to be on governmental assistance in the future. There are practical implications such as if schools, medical providers, parents, and community agencies collaborate, there is hope to improve this issue, and it will take a team approach to solve this. Their legal restrictions behind this are the GS 138-440.1, which requires schools to suspend students who don't comply. There are also quality of care issues, such as evidence shows that keeping kids in school improves quality of life, improves student success, and makes them more likely to graduate. I would now like to look at some options that we could use to improve these issues. The first option I want to discuss is to have school nurses collaborate with local resources to reduce the number of exclusions from school for children related to noncompliance with health assessments and vaccinations. The pros of this option are less children will be suspended from school and less schoolwork will be missed, and children won't get so far behind. Cons of this option are that school nurses are often understaffed and have little time to reach out and build new partnerships. A second option is to develop a standardized system of form intake, data collection, and management in order to efficiently and accurately identify children with gaps in compliance early enough to provide targeted intervention before the deadline. The pros of this option are it would streamline processes across the state so everybody would have a standardized process to follow. The cons are that it is very time consuming and difficult to provide training on new processes across the entire state, and often you may meet resistance from school nurses who have been doing the same process for a long time. The third option is to create an expanded community-wide marketing campaign. The pros of this option would be able to reach multiple partners and increase awareness of the requirements of the health assessments and immunizations. The cons are that marketing campaigns can be very costly, and it can also take time to develop and implement these campaigns across the state. Another thing that we can look at is to establish a transportation fund for families with transportation issues. The pros of this is we could give patients transportation to medical appointments. The cons are finding the funding to fund this option. It would be very costly to provide transportation for all of the populations that need transportation to medical appointments. The last option is to fund and establish more school-based health centers and staff with providers who can perform the health assessments. The pros of this option are that children will receive the health assessments and immunizations right at the school and in a timely manner. The cons of this option is a very costly endeavor, and it takes a lot of time to develop and implement and open school-based health centers. There are three main recommendations I'd like to move forward with. The first one is having school nurses work with local medical providers to educate them on the health assessment and vaccine requirements. Schools should also partner with local health departments and Community Care of North Carolina networks to address the reasons why children don't get the health assessments and improve access to care. These community agencies can help them reach out to these populations and help get these children in for the health assessment and vaccinations so they don't miss very important schoolwork. Legislators should also support adding more school-based health centers and make sure they are staffed with providers to perform the health assessments and immunizations. I wanted to talk a little bit about how we can use the Doctor of Nursing Practice Essentials to be advocates for our patients and healthcare policy. DNP Essential 5 calls for DNPs to be advocates for healthcare policy. Some ways we can do that is to reach out to our local and national legislators to support school-based health centers that are properly staffed with providers to perform health assessments and give immunizations. We can also be advocates for these children and help enact or revise policies that will help these children stay in school and receive the health assessments and immunizations in a timely manner. DNP Essential 6 relates to interprofessional collaboration for improving patient and population health outcomes. Schools should work with local medical providers to increase their understanding of the health assessment requirements and the vaccine requirements. Partnerships should be formed to address this issue. I hope that you enjoyed my presentations. If you have questions, please let me know. This last slide includes the references that were utilized to form this presentation. Thank you and have a great day.